Good morning, everyone. My name is Aksa Faith, and I'm talking on diabetes type 1, and my own part is to talk about some of the ways that we can manage diabetes type 1. And due to the complications that we just saw from my colleagues talking about the different complications such as blindness, liver damage, and so on and so forth, and kidney, I mean. So we see that we need to know how to manage some of these things in order to know how we can prevent, or we can to know how we can prevent not reaching diabetes type 1, or we can manage it, or whatever has to come. So the first thing I'm going to talk about is education. And education, when you learn about the disease that you have, it helps you to be able to manage that disease. For example, what is the difference between type 1 and type 2 disease and type 2 diabetes? When you know that type 1 diabetes is a genetic disorder, and it can show up early, and you know that type 2 is caused by nutrition, something you can manage with the food that you eat, you actually know the effort that you have to put into manage your diabetes. Looking at type 1 diabetes, we see that it's a genetic disorder, which means that there's nothing you can do about it, like nutrition or whatever. But you can actually, just your nutrition alone, cannot actually stop you from having diabetes type 1. But when you manage your nutrition, you can prevent yourself from having diabetes type 2, or from treating yourself with diabetes type 2. I'm talking from experience because my mom had diabetes type 2, and her nutrition, she controlled her nutrition, and then she exercised often, and so on and so forth, like some of the stages I'm going to put forward. So, and she doesn't have it right now. The doctor told her that she's free from it. So that is where I got the energy to be able to talk about diabetes type 1, to make sure that if it happens, it shouldn't get up to that level, which means if you manage your diabetes type 2 well, you will not be able to have diabetes type 1, because it's in the course of mismanagement of diabetes type 2 that you have diabetes type 1. Okay. Having that education on diabetes, then it says change your diet. That's the second way of managing your diabetes type 1. You have to change your diet. Some of the food that we eat, like carbohydrates, they increase our blood sugar levels. When you eat too much carbohydrates, it increases your blood sugar level, which means that if you eat less of the carbohydrates, you'll be able to lower your blood sugar levels. And you know that with diabetes type 1, when you have your blood sugar is too low, it's a problem. When it's too high, it's a problem. So when you eat things like vegetables, things that concern that have more fiber, you are able to manage the level at which your blood sugar has to be. And when you eat more carbohydrates, you see that it goes up, and then when you eat less, or you eat just more of vegetables, it's almost abnormal, and you are able to manage it. Then when you look at where it says your diet and your lifestyle. So your lifestyle, if you are an alcohol drinker, if you are a smoker, some of those things like that, you should know that it will affect your type 1 diabetes. So if you also exercise often, it will help you in your type 1 diabetes not to get worse, to be within the management level for you. And we look at take your medications as prescribed by your doctor. I was looking at the 7 rights of medication here. What are the 7 rights of medication? Can somebody just tell me, any right of medication, Okay, the 7 rights of medication are the right medication, the right patient, the right time, the right prescription, the right dose, the right documentation. When you are in a healthcare facility, they expect you to document well, and so on and so forth. But when you are the one that is taking your medication and not someone giving it to you, you need to know those rights of medication so that you can take the right medication at the right time, and you take the right dose, and you should make sure that it is you that is taking it, and not give your medication to another person because the person is having the same sickness or disease with you, and so on and so forth. So when you know, when you take your medications as prescribed by the doctor at the right time, the right dose, everything will be okay. Like you see some little notes, like type 1 diabetes means using insulin. However, if you have type 2 diabetes treatment plans, and so on and so forth. So with type 2 you have a treatment plan too. With type 1 you can also have a treatment plan depending on your kind of person, because
The reason why they cannot prescribe the same medication for everybody is because some people have certain reactions when they take medication. So they actually give medications according to your own, like your own system, how your body functions and how the medications react to your body and how your body can take those medications. And then we see that along the line, your treatment plan or your medications can change depending on how the previous medications were working on your body. If they're working on well, they will continue with it, but if they are reacting in one way or the other, they will have to change your treatment plan. And talking about exercise frequently, we talked about exercise frequently, like you have your exercise. Maybe some people might have challenges such as maybe handicap or one way or the other, but they will always have something the doctor will tell. If you are amputated or you have one thing or the other that is not okay with your body, they can always give you something that will make you relax, or like something that will help you to even relax your body in one way or the other. There's always a prescribed a fitness that is given to you. That's why some people register at the gym, they go more often, and so on and so forth. Then looking at number 5, it said do your blood sugar or glucose checks as prescribed by the doctor. I brought something here from home. Unfortunately, I didn't bring my alcohol wipe. I wanted to quickly show how to take your blood sugar. This is my pack here, which contains my notebook and my pen, and I have my strips here, my blood sugar strips, and I have my glucometer here, and I have the pin, like the one that you use to poke your body. So when you have like the alcohol wipe, you wipe your hand and you leave it to get dry for some few seconds, and then you use this pin to poke your body. And when you poke, this can come in different ways. In different healthcare facilities, they use different ones. So you poke with this one, and then you use the strip. You take the strip, and then you put into the glucometer. Sorry. Putting here into the glucometer, and then when you are poked and the blood is out, you wipe the first blood, and then you take the second one, you take. Then you will see when you take, it's showing here that it will always give you instructions on the screen. It's already telling you to put the blood. So when you put the blood there, the number comes up on the screen within a few seconds. Then you see your blood sugar level. When you see that it is too high, most people with high levels of blood sugar, they will drink water to lower it. I've been doing that to people. So when it's too high, the first prerequisite is that you should drink water. When you drink water, your blood sugar goes down. Drink more water. And then when it's too low, you drink like orange juice, apple juice to take it up a little bit to normal level. So you record it every time you take it. You make sure you record, because it is from those records that the doctor will be able to know how you are progressing. You write the time. It depends on how many times that you have to take your blood sugar. Okay, I wrote out something on the board, and then we also talk about the insulin. So your insulin, you look at the way you have to take your insulin. If you are somebody that you have a scale, when you take your blood sugar, if it is 300 and something or whatever be the level that you have here, you will look at your scale, and then you will know that at 300, this is how much insulin I'm supposed to take. Yeah, so if you eat too much carbohydrates, you just be expecting it to be high, so you have like 300, maybe 400 something, depending on your level of diabetes. And then you will have to inject insulin. You hold your body like you hold you put it on they mostly put it on the fat on the stomach, or on the fat on your biceps there, or your triceps, I don't know. Sorry. So when you hold most people take it on the stomach. So when you hold it like this, you put it like you're stabbing, and then you press the insulin gradually into your body, and then and another thing you need to know is like when the insulin starts working, when it's at its peak, and then when it's going down, so that you can know how to do it. And then it also depends on how many times you have to do it per day, so you can be able to manage it well. It depends. You have to know how many times you have to check your blood sugar a day. Some people take it 2 times. It depends on each person. So the doctor will tell you how many times that you have to take your insulin. So I'm gonna relate it to real life situation, our class situation. We've been talking about diabetes type 1, and I want us to talk about what we've been learning in class in relation to our topic, so that we can be able to conclude from there. Thank you. So I've mentioned a hormone while I was talking, or why all of us were talking. Can somebody think of any hormone that we mentioned while we were talking about diabetes type 1? I've just 3 seconds. Yeah, insulin. Thank you so much. insulin. So that's insulin. Can anyone remember another hormone that maybe is injected into someone with diabetes type 1? I just want to make use of our time restoring so that maybe when I put this, it will be able to help us to go faster. So these are some of the things that we need to know. Maybe our teacher gave us that for to revise. And then insulin. What secretes insulin?
Pancreas.
Thank you so much. Thank you. Okay.
Terrible girl.
And what is the target organ for insulin? The target organ? Body cells. Thank you so much. The reason why it's body cells. Thank you. The reason why it's body cells is because diabetes type 1 is a situation where your immune system is attacking and destroying your body cells, and your pancreas are not able to produce the insulin that the body needs. So that's why the target is body cells. Thank you. Effects on the target organ. Thank you so much. Decreases blood sugar. This is cool. Okay, blood sugar. I'm just going to write BG for blood sugar for us to go faster. And then the stimulus for secretion is high blood sugar. So glucagon, this one you inject it when you have, this one you take insulin, especially when you have high blood sugar. So when you take glucagon?
Low blood sugar.
Low blood sugar, thank you. Low blood sugar, okay. And then what is the glucagon secret? Thank you. Thank you. And then what is the target organ here?
Liver and muscle.
Thank you. And then we are done with this. So in conclusion, we have seen our complications and everything that we have to know concerning our diabetes type 1. And the recent research that is going on concerning diabetes type 1 is that the researchers are trying to see how technology can help in the treatment of diabetes type 1. So they are working on it. And even as far as insulin is concerned, they are kind of trying to see the different insulins and how they can set out, because the insulin they used to use is just the one that they will inject in you, and then they will come and inject again. There is another kind of insulin that they came up with. It's called basal something. I'm sorry. And it helps when it's a pump. When you keep it, it goes by itself. So it's timed and everything is all set up. It goes. And when you don't need it, you can actually pause it. So thank you very much.
Great job, you guys.